Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. What causes normocytic anemia? Normocytic anemia happens when you have a low number of red blood cells, which carry oxygen through the body. The causes of normocytic anemia include heavy bleeding, COPD, certain cancers, sickle cell disease, and hemolysis, a condition in which the red blood cells break open and are destroyed. /r/n/r/n This common type of anemia can be identified with a blood test. Identifying the cause and getting treatment are important aspects of managing normocytic anemia. /r/n/r/n This article will explore symptoms of normocytic anemia as well as causes, diagnosis, treatment, and prognosis. /r/n/r/n Jessica Olahrnrn Normocytic anemia occurs when you have a lower than normal amount of red blood cells. However, the blood cells are still typically normal size. The condition is also marked by low hemoglobin levels. /r/n/r/n In contrast, some types of anemia are microcytic, the red blood cells are small, and some are macrocytic, the red blood cells are large. These changes in size are usually due to different underlying issues than the causes of normocytic anemia, so the size of the red blood cells can help determine the cause of anemia. /r/n/r/n For example, iron deficiency is a common cause of microcytic anemia. The red blood cells are small, while vitamin B12 deficiency is a common cause of macrocytic anemia. The red blood cells are too big. /r/n/r/n The effects of normocytic anemia can range from mild to severe, depending on the red blood cell count and other medical conditions that can add to your symptoms. You may experience symptoms gradually if the anemia is slowly progressive, but the symptoms can worsen abruptly if the anemia develops rapidly. /r/n/r/n Common symptoms of normocytic anemia include /r/n/r/n You can expect several of these symptoms with normocytic anemia, and some people only experience a few of the effects, especially if the anemia is mild. /r/n/r/n You may also experience other symptoms that aren't necessarily directly related to the anemia, but they can signal the cause of the anemia. /r/n/r/n Associated symptoms can include /r/n/r/n Normocytic anemia is a common complication of many different illnesses, and the associated symptoms can begin before or after the symptoms of anemia. /r/n/r/n Normocytic anemia can happen due to bleeding, chronic disease, or low red blood cell production. Some people are born with the disorder. /r/n/r/n There are many different causes, and the condition can be more severe if you have more than one cause. Chronic inflammation can lead to reduced production of red blood cells. /r/n/r/n Common causes of normocytic anemia include /r/n/r/n Chronic disease may shorten red blood cells' lifespan, contributing to anemia. /r/n/r/n Sometimes, the cause and risk of low red blood cells are known before normocytic anemia becomes symptomatic. Symptoms of anemia may begin, or the red blood cell count can be used to diagnose anemia before the causative condition is known. /r/n/r/n If you are at a known risk of anemia, your doctor may order blood tests to monitor your red blood cell count. /r/n/r/n The diagnosis of normocytic anemia is established with blood tests. If you have a serious injury with substantial blood loss, you would have a complete blood count, CBC, which would provide quick information about whether you have anemia. /r/n/r/n You may have a blood test to evaluate your red blood cell count if symptoms or physical examination findings raise concerns that you could have anemia. Sometimes, normocytic anemia is diagnosed incidentally due to a routine CBC blood test done for a checkup. /r/n/r/n Pale skin, a rapid pulse, a weak pulse, or low blood pressure are signs of anemia that your doctor may detect on your physical examination. /r/n/r/n blood tests that detect anemia, /r/n/r/n. The diagnosis of normocytic anemia often involves a search for the cause if it isn't already known. /r/n/r/n tests you might have during your assessment may include /r/n/r/n your symptoms, medical history, and physical examination would guide the diagnostic tests that your doctor would order during your anemia assessment. /r/n/r/n treatment of normocytic anemia can include controlling blood loss, treatment of underlying disease, blood transfusion, and medication to promote red blood cell production. You would likely benefit from one or more of these treatments, and most people do not need all of them. /r/n/r/n treatment for anemia is important, even if you don't have symptoms. Anemia can worsen your overall health and make it harder for you to recover from illnesses. /r/n/r/n red blood cells last for an average of 120 days. Your red blood cell count should improve within a few weeks with treatment. /r/n/r/n if the cause of your anemia is acute, sudden and short-term, such as trauma, then you are likely to have lasting improvement after short-term treatment to alleviate blood loss and after a blood transfusion if your anemia is severe. /r/n/r/n chronic normocytic anemia may require consistent treatment of the underlying cause so the red blood cell count will become normal and prevent anemia's recurrence. Lifestyle approaches can also help maintain a healthy red blood cell count. /r/n/r/n anemia is low red blood cell number or function. Normocytic anemia is a common type of anemia with a low red blood cell count and normal-sized red blood cells. It can develop due to blood loss, low red blood cell production, or chronic disease. /r/n/r/n red blood cell loss can often be stopped with medical or surgical interventions. The symptoms and red blood cell count will usually improve with treatment of the cause of anemia. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.